Okay, everyone, welcome to week 3 of our Men's Health Month celebration. And this topic really pertains to everyone because it's estimated that 80% of individuals will experience low back pain at some point throughout their life. And so our topic this week is low back pain. So question number 1 on the list is, what does it mean if I have a disc injury? Okay, so this is a really common injury that we have. I'm ranging anywhere from younger age, teenagers, all the way through adulthood, and so we can have it in various ways. And so the three things we think about with a common disc injury, which would be the posterior lateral disc injury, is a bulge, a herniation, and a complete rupture. Okay, and so our discs are made up of two parts. We got it's kind of similar to the consistency of a jelly-filled donut. Okay, so here's our disc here. Okay, this isn't a perfect model of it, but the inside portion of it is our jelly-filled donut. So we call it the nucleus pulpus, and it's just filled with a viscous base fluid, and the outside is actually a ligament called our annulus fibrosus, with fibers that run kind of like so all the way around, which give it its strength. Okay, so a bulge is when we just have a push of the inner fluid, so that jelly, into the annulus. Okay, and a herniation is when it actually pushes outside of it. So this would be a depiction of a herniation. Okay, and a rupture is when the annulus completely ruptures and allows the jelly to come out of the inner portion. And we can also have disc injuries kind of in 3 different areas mainly, or most common. So posterior lateral is the most common, which is why I started talking about that one. So we got the back side and to the side, or we can have them straight to the side, and then we can have them central as well, so it comes straight backwards. So they're all going to present with kind of some different symptoms. A central herniation could present with symptoms down both legs. It can present with some upper motor neuron symptoms such as some spasming as well, whereas a lateral or the posterior lateral will present with typical symptoms down one side of the leg. And you just numbness, weakness, and stuff like that. And the treatment for all of these are completely different as well. But I also wanted to talk about the healing of a disc. So a lot of people think once they've injured a disc, it's going to be injured for life, and it's not necessarily the case. We now know that that nucleus will actually move back into the interior of the disc like it's supposed to, or like where it was meant to be, with some proper treatment. Now, without proper treatment, there's a chance it can stay injured for life, but with proper treatment, it can actually move back, and then that annulus can actually kind of scar down and heal back up again. Some people think that you have increased risk for re-injuring that for life. There's different philosophies on that. Yes, there is a chance that you can re-injure it. Whether we know it's increased risk, we really don't know at this point. But yes, it can heal with the proper treatment. I also wanted to talk about some sciatica with this, because a lot of people will just say, oh, I have sciatica. Well, it's probably actually from a disc injury or a low back injury itself. Because what can happen is that nucleus comes out, it puts pressure on our nerve, which causes those symptoms down the leg. Again, that's why it's really important that we get a thorough evaluation when we have sciatica or back pain, because to figure out what's going on, whether it's coming from this disc injury, whether it's coming truly from the sciatic nerve, or whether it's coming from something else in our back that could be causing some pressure on that nerve. Okay, question number 2 is, I always get back pain when I start working in my yard in the spring. What can I do to help with this? So first I want to talk about why we get back pain in the spring after our long winters. And a lot of times it is due to poor muscular strength and endurance. So if we are going all winter like most people do, if you're like me and we hibernate all winter long and here in Kansas hiding from the cold, we're not putting our body through a lot of stresses. Okay, so we're not strengthening our muscles and our core. And then all of a sudden springtime rolls around and we're going out. We're working in our yard for hours a day, whether that's trimming trees, raking leaves, carrying mulch bags, or putting in new plants. And so we go from doing a little bit of nothing to a lot of something. Okay, and that's a big shift in strain onto our muscular system. Okay, so if that's the case, the best thing we can do is continue to strengthen all winter long. Okay, go to a gym, have a good home program, and work on some core strength all winter long. Not just core, but lower extremity strength as well, because a lot of times what do we need to do? We need to squat, bend over, and pick stuff up. And so that becomes really important. The other thing that goes into the whole squatting is our body mechanics with that. Okay, so if we are needing to now bend over a lot and we're just bending at the waist and not from our hips, that can be really strainful on our back, especially if we're lifting up heavy objects. So we need to be able to perform a good, proper squat to bend over and pick stuff up. Also, if in order to do that without injury. And next week we're actually going to talk about some proper lifting mechanics. So tune in then to watch Scott discuss some of that. And the other thing is when we spend a lot of time bent over in a flex position. So that ends up being harmful on our back, especially our discs, which I just talked about. So if we're going to be bent over a lot, such as pulling weeds or planting or digging anything, it's important to either get in good position, or if we can't get in that deep position, get into a kneeling spot. So if we kneel or kneel with one leg down, that can really help us with scooping up there. So those would be kind of the big things. The main thing is actually really just the muscular strength, like I alluded to. It's important to continue building that strength all winter long, so that we're not throwing all this stresses onto it in the springtime. Okay, question number 3. So I had an x-ray of my low back and it showed degenerative disc disease and arthritis all over the place. Can I feel better, or is this my new normal? And really the short answer to that is no. And the big thing is that, like, yes, there's stuff we can do to that. Regarding the arthritis, it kind of goes into my talk that I discussed last week about how movement is the key to any arthritis in the lower extremities, but includes the back as well. So our spine needs to move, our body needs to move, increases the lubrication of those joints and helps us feel better. Degenerative disc disease is kind of a funny statement as well, because this can actually be a normal part of aging. They've actually done some MRI studies of individuals over the age of 50, and the older you get, the more likely it is that you have degenerative disc disease and arthritis in your back. This is in people with, these studies were done in people who were asymptomatic, meaning had no back pain. So sometimes it can be a very normal part of aging that happens. Sometimes we think that that's why we get shorter as we age as well, because we're losing that disc height, which is that degenerative disc disease. Now, why do you have pain though? That's really the big question. Maybe we have poor core strength, so we're not able to stabilize. Maybe we have poor flexibility in our back and or our hips, or our mid-spine for that matter, so we've got more stresses on our back. So it's really important to evaluate all that and see what's going on to improve your symptoms and your pain. The other side to that is also our weight. I know I talk about weight gain a lot, but weight gain, especially if we happen to be individuals that sort in our abdomen, can cause a lot of pain in our back, especially when we have degenerative changes like that. Because the way our body is set up, we're supposed to have all of our weight should be centered over our sacrum, not in front of it, not behind it, not above it or below it, right over our sacrum. Well, if we get excessive weight anteriorly, so in our abdomen, now our weight's going to be shifted disproportionately forward. Okay, so now instead of our weight going straight through our spine like it's supposed to, now it's coming forward, which is going to apply some strain on the backs on our back, actually the back side of our spine, right? So it's going to make our ligaments and our muscles tauten all day long in order to stabilize because of that. So yes, sometimes arthritis and degenerative disc disease can be a normal part of aging, and no, pain does not have to be your new normal. There are things you can do for it, flexibility wise and strengthening wise. So it's important to get in with a physical therapist, get an evaluation and a good treatment plan going forward so you can start feeling better. Okay, question number 4 is, am I at increased risk for injuring my back if I have to sit at my job all day? And I don't have any specifics on percentages of risk, but yes, you would be at increased risk for that. Because answer number 1 is our body's meant to move. We're supposed to move all day, not just sit in a stagnant position. And that'd be in any stagnant position. If it's sitting, standing, and whatnot, our body's meant to move. If we sit in one position, we're going to start adding some strain and stresses on certain structures. In sitting in particular, we start adding more strain onto our discs. So I kind of spoke about our disc injuries earlier. When we sit in a flex position, we put increased strain on the backside of our disc, which is the most common area for that disc to herniate. And so sitting all day puts us at increased risk for that. Especially think about the person that's sitting most of the day and then they go out and do something physically active. Okay, so you're sitting at your desk all day, you get home from work after you sat in your car and you go do yard work where you're going to be bent over, raking, picking up, lifting things. Okay, well now we put ourselves in a lot of a flexion-based position, which puts a lot of strain on the backside of our disc, which is going to put it at increased risk for injury back there. Okay, so the important things with this is to get a standing desk, okay, or a desk at least you can move to stand. Not saying I want you to stand all day, but at least every hour try and stand up for 10 to 15 minutes, or try and walk down the the hallway to the water cooler and speak to some coworkers. It's just important to move and change our positioning there, because if we go from sitting in our desk all day to doing something at home, we're gonna be at increased risk for injury there. And again, our body is meant to move. We're meant to change our position frequently, so that way we can prevent that. Now I know that we're in the era of sitting a lot for work in the modern era, so it's just important to get these standing desks and try and move throughout the day. Get one of those smart watches that maybe give you a ding every hour to stand up and move. That can help you with preventing that.